If you've noticed a nagging pain at the base of your second toe, particularly when you're walking, climbing stairs, or pushing off the ground, you're probably wondering what's going on and whether it's something you need to worry about. Discomfort, if it's not resolving on its own by the next morning, keeps coming back day after day, your body is trying to tell you something. You may be dealing with a condition called capsulitis. Because this condition can cause toe dislocation and other serious foot complications, it's important to get a diagnosis quickly. Today I'm going to walk you through everything you need to know about capsulitis, what it is, what causes it, how it progresses, how it's diagnosed, and most importantly, what you can do to treat it and stop it from getting worse. But before I get started, I'd like to introduce myself. I'm Dr. Rion Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook called How to Stop Your Ball of Foot Pain. It describes capsulitis and several other ball of foot conditions, some of which can mimic it. You can download it in the description below. If you find the information in this video helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification each time I release a new video. You may be wondering, what exactly is capsulitis? It's an inflammatory condition that affects the ligaments surrounding the joint at the base of your second toe. Those ligaments form what's called a capsule, and the name of the condition, capsulitis. Their job is to keep your toe stable and properly aligned, connecting it to the long metatarsal bone that runs through your forefoot and up to the midfoot. When that capsule becomes irritated or inflamed, whether from overuse in sports, poor foot mechanics, or structural factors, the joint starts to break down. It becomes painful and swollen in the soft tissues and increasingly unstable. Here's where things can get serious if you ignore it. Left untreated, those ligaments don't just stay inflamed, they gradually weaken. And then as they weaken, they lose their ability to hold your toe in its proper position. Over time, this can allow the toe to drift, shift, or even dislocate up above. That's why capsulitis is often referred to as a pre-dislocation syndrome, because without intervention, that dislocation can happen next. The good thing is that when capsulitis is identified in its early stages, it responds very well to conservative treatment. You don't have to resign yourself to surgery or long-term disability, but the window for catching it early is important, which is why we want you to be informed. Capsulitis doesn't usually appear out of nowhere. There are a number of factors, both structural and lifestyle related, that can increase your risk of developing it. Let's go through the most common ones. First, foot structure plays a significant role. If you have what's known as Morton's toe, where your second toe is longer than your big toe, that'll place more pressure on that second metatarsal joint with every step you take. Over time, that added stress adds up. Similarly, people with flat feet, even high arches, or a tendency to overpronate, roll in, and fall down the arch, meaning the foot rolls in excessively, this will put even more excessive load on the forefoot, which can cause increased inflammation. Activity level is another major contributor. People who engage in repetitive, high-impact activities are particularly vulnerable. Runners, tennis players, pickleball enthusiasts, and basketball players all put significant and repeated stress on the ball of the foot. But you don't have to be an athlete to be at risk. People who spend long hours on their feet for work, whether in healthcare, retail, food service, or other fields, can all develop capsulitis simply from the cumulative effect of standing and walking day after day. Age is also a factor. As we get older, the joints and soft tissues in the feet can become more mobile and less stable. This is a condition known as hypermobility. This age-related loosening of the foot joints can make the capsule around the second toe joint more susceptible to stress and irritation. And then there's footwear. High-heeled shoes in particular are a major risk factor because the capsulitis can develop as you shift your body weight forward onto the forefoot with the high-heeled shoe. You just don't want that concentrated pressure right in the ball of the foot. But even flat shoes without adequate support can be problematic, especially for those people with flat feet who overpronate. Capsulitis symptoms develop gradually in many cases. Many people ignore them because they assume they'll go away on their own. But over time and without treatment, those symptoms can progress through distinct stages, each more difficult to manage than the last. In the early stages, the most common complaint is a dull or aching pain in the ball of the foot, centered near the base of the second toe. Many patients describe a sensation that's almost like there's a marble or a small pebble stuck inside their shoe, even when there's nothing there. If you notice mild swelling around the base of that toe, some people will find that walking barefoot on the floor can become particularly uncomfortable. At this point, the joint is irritated, but the structural damage is minimal. This is the best time to seek treatment. As capsulitis moves into its middle stage, the pain becomes more pronounced, not just with activity, but potentially at rest as well. You may begin to notice a visible change in the alignment of the second toe, and it starts to drift toward the big toe and up. A noticeable gap may occur between the second and third toe. Shoe shopping becomes a frustrating experience because finding footwear that doesn't aggravate the pain gets harder. At this stage, the ligaments are under real stress, and the window for straightforward conservative treatment is narrowing. In the advanced stages, the joint damage is significant and often really visible. The toe may rise up in a claw-like position, what's called a hammertoe, and partially dislocate on top. In some cases, the toe will actually cross over the big toe entirely. Calluses can form where the misaligned toe rubs up against another toe or against the shoe. And at this stage, there's genuine risk of complete joint dislocation and rupture of a structure called the plantar plate. This thick band of the capsular tissue helps stabilize the ball of the foot, and it's crucial not to let this get to that stage. The need for surgery becomes more likely at this point, which is why I can't stress enough the importance of addressing this condition early. If you're experiencing these symptoms, it's important to get a proper evaluation and not just to confirm capsulitis, but to rule out other conditions that can look similar. The most common condition that gets confused with capsulitis is Morton's neuroma, which also causes pain in the ball of the foot, but it's only between the third and fourth toes. Morton's neuroma involves nerve tissue rather than ligament tissue. It can be numbing, burning, tingling pain, and requires a different treatment approach. Getting the right diagnosis matters because treating the wrong condition won't give you relief and it wastes valuable time. Diagnosis typically starts with a thorough examination of your foot structure. I'll look at the alignment of your toes and the overall mechanics of your feet and move the affected area through a range of motion to try to reproduce the symptoms and test the stability of the joint. X-rays are usually taken to assess the bones and joint structure, and in some cases, imaging, such as an MRI or ultrasound, may be recommended to get a clearer picture of the soft tissue damage. The good news is that when capsulitis is caught in its earlier stages, there are several highly effective non-surgical treatment options that are very helpful. The goal of treatment is to reduce inflammation, stabilize the joint, relieve pain, and correct any underlying mechanical issues that may have contributed to the problem in the first place. First, I'll tape the affected toe and teach this to you so you can keep it under less stress. This helps take stress off the ligaments and can provide noticeable relief quickly. If the inflammation and pain are more intense, a cortisone injection can help rapidly reduce swelling and discomfort. Giving the joint a chance to settle down is important, and for patients with more severe pain, a walking boot may be recommended to fully offload the area and allow healing to begin. Longer term, custom orthotics are often one of the most important pieces of treatment in solving this puzzle. A pair of orthotics is designed specifically for your foot type, and mechanics can redistribute the pressure away from the joint and address the root causes, whether that's overpronation, such as exists with flat feet, or other structural issues like high arches. This all can make you vulnerable to capsulitis in the first place. Whether you're trying to prevent capsulitis from developing, or you've already been diagnosed and want to slow its progression, there are practical steps you can take right now. Avoid high heels as they concentrate a load in exactly the wrong part of your foot. Instead, look for shoes with good arch support, that they bend at the ball, not in the middle, and don't flop side to side. A wider toe box allows your toes to spread out naturally without being compressed together. If you have flat feet or overpronate, supportive footwear is an optional, it's essential. Those foot types place disproportionate stress on the second metatarsal joint, and walking around in unsupportive shoes is like adding fuel to the fire. Avoid walking barefoot, especially on hard surfaces, since going without shoes eliminates whatever cushioning and support you might otherwise have. And if you're engaging in high-impact activities, consider modifying your training load temporarily to give your foot a chance to recover. If you've been dealing with persistent pain in the ball of your foot, especially near that second toe, don't wait and hope it goes away on its own. Capsulitis is one of those conditions where timing really does matter. The earlier we can evaluate what's happening, the more treatment options we have available, and the faster your recovery is likely to be. This way, you're more likely to be able to keep you out of the operating room. Come into the office so we can get a clear picture of what's going on and put together a plan that's right for you. Whether you're in the early stages of discomfort or you've been struggling with this for a while, we're here to help you get you back on your feet comfortably and confidently.